My name's Michelle Rabitsch, and my AOC story starts actually back when I was even a teenager, growing up in Madison County with leg issues, and saw Dr. Moy for those, which thankfully turned out to be nothing more than shin splints. But in more recent history, I came to AOC to Dr. Julian Price in 2010, 2011. With neck issues. My GP had established that I had arthritis in my neck, and I had been suffering with migraines for probably 2 to 3 years. And it had gotten to the point where it just wasn't getting any better, and they were 3 to 5 days a week, and they were laying me out on the couch. So my GP decided I needed to go to an orthopedic, so I came back to AOC because my family has been to them for years, and we've always known about the quality of care here. First came to Dr. Price and his wonderful nurse, Lisa. I have to get Lisa in on this. And was very impressed. He was, I think, fairly new to the firm at that time, but he had a passion for what he does. When he first came in after my x-rays and my MRI, and we started talking about what my options were and what the issues were. I had a bone spur and a bulging herniated disc, and then unfortunately we suffer from severe arthritis in my family. So I had a diseased, as he put it, disc up above, which had resulted in nerve pain. I had just literally woken up one morning with pain from my elbow, my shoulder, all the way down through my arm. He gives you all the options that you have. He basically said, this is nothing that's going to kill you, nothing that's going to paralyze you. You have the option of going with the safest first-line approach of therapy, which I did do for a while and got a little result out of. And then beyond that, we could go into injections, which I did once, and I know people who have had great results. I, unfortunately, was not one of them. And then the third option was surgery. I had that done in December. I was back at work half days in 2 weeks. And for the most part, if I don't point out to people that I have had neck surgery, they can't even see my little scar because he so sweetly put it in the fold of my neck, which I told him at my age it was okay to call it a wrinkle. Since then, I did great for 2 or 3 years and started experiencing some lower back pain. There again, came to Dr. Price. He looked at things, said basically it was going to be up to me how we treated it. We started off with some physical therapy again. Went from physical therapy to, I probably worked with it for 8 months to a year, and then started having a lot of severe foot pain. It literally just felt like somebody was whacking the top of my feet all the time. That was when I decided we had to do something else. We did a couple of rounds of back shots, and I got a little bit of relief from it. But overall, it came, unfortunately, back to surgery again. Now, I come from a family with back issues, so unfortunately, it wasn't surprising that this was going to happen. I watched my father go for years with nerve pain and disc issues, and then once he did have it fixed, he didn't get all of his sensation back. So I learned from his mistakes that I wanted to go ahead and get it fixed and not be the one who couldn't feel my feet even after the work. We decided to do my back surgery October of 15. Yes, because this past October was a year. He did L4 and L5, inserted a spacer, got the pressure off the nerve, and pretty much I saw immediate results. The back surgery was a little more uncomfortable, but very well worth it. He's always done everything to make sure I'm as comfortable as possible. When I go home, I don't hesitate to email Lisa and let her know if I have questions or if I have issues or is this supposed to look like that. He's always very prompt in taking care of my questions. I did well enough that I was released that January back to, as he put it, 98% of whatever I could do before, and if anything hurt, just stop or rest. I've gone back to being active. I have a 2-year-old grandbaby that I love to chase around when I get a chance. And my husband and I did 2 weeks out in the Tetons and Yellowstone and the Rocky Mountains in May. So about 6 months after surgery, I was back out hiking.